Welcome to Season 1, Episode 14 of the Home Healthcare Today show. I'm your host, Dr. Cleamon Moore. It is September, and in September, we spend a little time, important time, focusing on a very important and significant topic. And that topic is ovarian cancer awareness. So, on our show today, we are fortunate to be joined by the co-founder and past president of the Michigan Ovarian Cancer Alliance, Miss Pam Dahlmann. Let me tell you all a little bit, for our listeners and viewers, a little bit about Pam. Pam was trained as a registered nurse at the University of Michigan School of Nursing. Her focus was on pediatric nursing in the pediatric ICU at Mott, and then on to home care, specializing in children with trachs and ventilators. She eventually became a branch manager for a private duty home care nursing agency, Visiting Care, an arm of the Visiting Nurse Association of Ann Arbor. She continued this work as a discharge planner at the University of Michigan Hospitals and Mott Hospital, once again, helping children with special equipment needs at the time of discharge to transition home successfully. Pam has also worked with these medically fragile children in their school settings. She was a one-on-one provider in the Saline School District for 7 years. Her passion changed a bit when her mom was diagnosed with ovarian cancer in 2008. At the time of her diagnosis, there was no statewide support for women who were diagnosed with ovarian cancer. Together, she and her mom founded the Michigan Ovarian Cancer Alliance. Now, as for the mission of the Michigan Ovarian Cancer Alliance, MIOCA strives to save lives by promoting the early detection of ovarian cancer and improved treatment outcomes. MIOCA raises awareness of ovarian cancer, provides resources and support to survivors and their families, advocates both locally and federally, educates Michigan communities, and funds innovative ovarian cancer research. Pam, welcome to our show today.
Thank you for having me.
Pam, as I stated in your introduction, this is certainly a very important topic, to discuss. It has a very sensitive nature to it. Pam, do you mind sharing with us a little more about yourself? As a registered nurse, your research, your passion, and what led you to co-found the alliance with your mother?
Mm-hmm. I think ovarian cancer is a disease that, I knew very little about. In nursing school, it's not something that they ever really educate you on, maybe a little bit in a textbook. But it was, as you mentioned, when my mom was diagnosed in 2008, that it became on my radar, right there in front of me. And not only did my mom have ovarian cancer, but my maternal grandmother had ovarian cancer. And so she died at the age of 71, and then my mom actually eventually passed in 2011. And so I sit in front of you after 50 years now, this year, 2021, of having lost both my grandmother and my mom to ovarian cancer. And, it is a disease a lot of people will say is a silent killer. Yes. We like to say silent no more because there are symptoms that go along with ovarian cancer. And, yes. And most people don't recognize what those symptoms are, or they get mistaken for other types of situation. A lot of people will think it's the flu or something with their GI system. And so, for example, the 4 cardinal symptoms are bloating, not just, you feel indigested or whatnot for a period of time, but to the point where you have to go home and feel more comfortable in pants that don't button but have elastic waistband, or after 2 weeks or 3 weeks you're buying new pants because you don't fit in your pants anymore. Abdominal or pelvic pain, and again, that can be so vague. Having changes in your urination, or you're either going more or less, or in your bowel habits. And then also the feeling of fullness. My mom would be starving and fill her plate and could only take 1 or 2 bites, and then would push her plate away. And, those are symptoms that are so vague. And for women who are, perimenopausal, they're experiencing that on a monthly basis with their menstrual cycles. And so, there's a lot of times they are just missed, and so it goes into the advanced stages. There's no diagnostic test for this disease, and so I think more than anything, as a nurse, as a healthcare provider, I wanted to be that voice to try and help say there are symptoms, and let's be educators, let's raise awareness, and so that's what we have been able to do. Michigan Ovarian Cancer Alliance filled that void, for the statewide need.
Very nice, Pam. And Pam, we sympathize and empathize with the passing of your mom, as well as your grandmother, to this disease.
Thank you.
We definitely congratulate you on taking their legacies forward and co-founding an alliance, a statewide alliance that could be of greater support to girls and teens and young women and women of all ages who may be diagnosed with this disease. So going back to 2008, starting this, and then dealing with the passing of your mom in 2011, talk to us a little bit about the first 3 years, I guess, of the alliance with Mom, and then to date, some of the major milestones and accomplishments of MIOCA.
I think the most important thing to say is when my mom was first diagnosed, she too was a nurse, and we were looking for that support. We were looking for other survivors, and there just wasn't the network that was in place. So, Michigan Ovarian Cancer Alliance was able to fill that void, and it has been, there as a support system for other survivors. And I think for me, that's been so neat to see, and I know my mom would be smiling down on us with that, because it's changed a little through the pandemic. We haven't, unfortunately, been able to do as many in-person things, but overall, that support is there. And one of the things we strive to do is be there as a network, be there to not only provide the resources that a new survivor might need, but also connect those survivors through our support groups. And we used to do those in person, and now they've become more along the lines of a virtual type of format. And we used to have a educational seminar, and some of those have gone to webinars and Zoom, and but we've been able to make that adjustment, which has been wonderful. Not only the support, which is first and foremost in my mind, but second would be advocating for this disease, but also for a woman who is going through that, to be the voice and to be there to make the laws, or raise the bar. Our funding has drastically increased because there's power in our numbers. Unfortunately, with this disease, women don't live as long as some of the other cancers. And so when we can unite our voices, whether it is the survivors or their caregivers or offspring, to be able to make that difference and rally and get the research funding that is so drastically needed to try and find that early detection test.
Absolutely.
Absolutely.
So Pam, as a nurse, as you shift back and forth between being an advocate, a co-founder of a statewide agency, a past president, as you slip back into that clinical mode and put on the nurse's hat, what are some of the therapies and treatments that you've seen over the last several years?
I think Ironically enough, the carboplatin and Taxol, which are the first line of defense for chemotherapy, carboplatin was discovered at Michigan State University, which kind of blows everybody's mind. But that was the same frontline treatment given to my grandmother that my mom received, and is still actively given as the frontline therapy today. And so, there's a long ways that we need to still come, but all in all, new clinical trials are coming out, and new advancements have been made in the pharmacological division, and women are living longer because of those advances. And one in particular that was in the clinical trial as my mom was failing was the PARP inhibitors. And PARP inhibitors are used successfully for ovarian cancer. They're also in clinical trial for other cancers to date, but they are a targeted therapy drug that women can take orally, and not have to go in for infusions. They're able to take that from their home on a daily basis, and women are living longer on those PARP inhibitors. So that's a huge advancement that has come a long ways. And there's going to be others. I know, there's all kinds of research happening, and we can only hope. We hold on to that hope.
Absolutely, Pam. Yeah, so this is very rich information. It's not common knowledge, right? So from the layman terms, or in layman terms, how could listeners and viewers get more insight and more information? I know you made great mention of some of the webinars and the like, but how can folks positively be impacted by the Alliance and all of this knowledge that you are sharing with us today?
Mm-hmm. I think, as I mentioned, the pandemic has really changed the way we've done a lot of things, but overall, our positive impacts have been going into the community for the education and awareness piece. We have a program called SPEAK, which is Survivors Promoting Early Awareness and Knowledge, and we've been in churches, we've been in synagogues, we've been in fitness centers, we've been in lunch and learns at places of employment, and we've have those survivors telling their stories, and that's powerful.
It is.
We've also used those same survivors and people like me who experienced what I have with my own mom to go through and statewide and federally ask for new laws and that research money that I've been talking about. We've been able to advocate in the state of Michigan. Oral chemo is not equivalent to IV infusion, and so we have fallen behind in raising the bar for that oral parity. So we still continue to advocate for that equivalency, and even federally it hasn't been recognized. So we're doing that both statewide and federally, and getting with our politicians and trying to make a difference. So
wonderful, Pam. This is great advocacy, opening up doors, and then knocking down walls, bridging the gap between various forms of treatment, and then increasing the awareness of ovarian cancer research, and then some of the latest trends and developments. Prior to our commercial, I'm going to go a little bit deeper. Granted that we are still in a pandemic and somewhat of a resurgence of the pandemic. And I like to say that whenever women are healthy, the world is healthy, right? And with that being said, let's talk a little bit about the psychological impacts, right? And from your experience, some common resources or some tips for assisting some of our listeners, and even men too, in terms of men being of a greater support to the women in their lives who may be impacted by this disease. So, from your experience and knowledge, how can we better address some of the psychological impacts prior to us taking a commercial?
I think the psychological component is huge, because it's physically and it's mentally, and not only is it for just the survivor, but it's also for the caregiver, for the family. The physical changes that happen are you're put into an instant menopause state. When you have the debulking surgery and they have a hysterectomy, those your progesterone and your estrogen are gone, and so your hormones aren't there any longer. And so, we're talking about all ages. There was a little girl in Ann Arbor where I live that was 5. She was in kindergarten when she was diagnosed, and Marielle passed at the age of 8. And people are surprised when I say that about her, but we're all born with ovaries, and so it doesn't age discriminate. It doesn't racially discriminate. There are no discrepancies. It's affecting many different ages. And I could go on and say that Katie is still living, and she had been diagnosed at the age of 10, and Megan was 9 when she was diagnosed, and those two living without their hormones and having that surgical menopause happen at that young age, then you're dealing with infertility. Absolutely. And so that affects not only the woman and the physical component, but also the psychological component of the worry, the anxiety of what if I wanted kids? That wasn't a choice. And, the body image changes, not to mention. And, then there's the mental component of, somebody in treatment who, this becomes a chronic disease. You're diagnosed, and then you may be fortunate to get into no evidence of disease, NED status, or remission. But, unfortunately, it comes back. And so, it becomes chronic, and those women then are dealing with the what ifs, or what happens. I want to move on with my life, but what's next? And I want to take that vacation with my husband, but should I? Because I might be back in treatment, or I don't know what next treatment is coming. And so, you can only imagine if a female is experiencing all of that, how does that affect the family member? And so, that support is just greater than the survivor alone. We would love to be able to support more, and that's probably one of our biggest goals, is to support more of the caregiver. And, but in the meanwhile, we connect, since MIOCA is not able to do that, we connect people with our community, because there are other agencies that are doing great support and for the caregivers. So
Pam, your transparency is wonderful. How clearly you articulate not only information and knowledge about the disease, but walking in those shoes, being someone who was impacted directly, by your mom and grandmother, and also knowing the stories, right? Knowing the stories of survivors, right? That work in the Alliance, work along in the agency, and also carrying on the torch and the legacy, of those, besides your loved ones, but carrying on the legacy of even young children, right? Who were impacted, negatively by the disease. Pam, we're going to take a commercial and come back and talk more about MIOCA.
Great, thank you.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle-tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today. Welcome back to Season 1, Episode 14 of the Home Health Care Today show. And yes, it's September, and we're having a very in-depth conversation about ovarian cancer awareness. And we are joined by Pam Dahlmann as we continue this dialogue. Okay, Pam, prior to our break, we were talking a little bit about psychological impacts for not only the patient or family members and survivors, but also caregivers. And in that, during our break, we talked a little bit about genetics and heredity, right? And we know that there's things that we could modify about our heredity, but then there's some of the non-modifiables and some of the advances in genetics and genetic research. So do you want to speak to that a little bit as well?
Sure. I think, one of the important things that's very personal for me is having my mom and my grandmother, as I mentioned, with ovarian cancer and a very strong family history on my mom's side of different cancers. We were kind of surprised to find we did not have a genetic mutation, but there are, believe it or not, with ovarian cancer, a very small percentage of females that have a genetic link. Angelina Jolie made it very common knowledge about the BRCA1 and 2 gene, and there's again a very small percentage of those diagnosed with ovarian cancer that have that BRCA gene. But it is important to know your family history, and I would say that if you are a survivor of ovarian cancer, it's very important for you to be genetically tested. And what that means is, seek out a genetics counselor and find somebody who you feel comfortable talking to. And there's a website, I'll see if I can come up with it, that you can go to. I think it's Find a Genetics Counselor .ncsg.org, something like that. And if you put those words in, it should pop something up. And that would be within your area. You could find someone to talk to, or you could talk to your physician too. Your physician would be well advised. Because so many people. I'll speak again personally. We had our first executive director who had lost her mom when she was 21 to ovarian cancer, and she had not done genetic testing, and she went on to find out that when I encouraged her to get the genetic testing, that it came from her dad's side, and people are often surprised to think that it's not only on the female side, but it can also come from the male side, and so she credits me for saving her life, because she then found out she does have that mutation. And having a young daughter, that's important knowledge. And we say knowledge is power. A lot of people, like my mom, was very concerned about getting genetically tested because she was feeling, if I leave that to you and then my two daughters, the guilt that goes along with it. And, as a nurse, I think she came around to realizing there's a lot of importance in knowing your health history and knowing your family history. So she did have the genetic testing done.
Good. Yes, and then it's not an opportunity to carry guilt per se, but there will be obviously grief, but ultimately gratitude, right? Gratitude in knowing and sharing the knowledge and sharing the insights and looking at preliminary tests in advance, indeed. So for the more advanced stages, for someone that is diagnosed and is homebound, Pam, what do you suggest? We're American Advantage Home Care. We provide skilled home health care services and therapy to patients. What is a better way for us as an agency to be able to support patients and families? And I ask you, greatly because of your background as a home care nurse, right? And then your knowledge and experience with this particular illness.
I'm going to start because I haven't said it, but unfortunately, without a detection test, most people think that a Pap test or Pap smear will detect ovarian cancer. It does not. There is no diagnostic test. So when you are having your annual physical checkup, you're not being screened for ovarian cancer. There may be a pelvic rectal exam done, but if a tumor or anything is found at that time, it's going to be in that advanced stage. So only 15% of women are found early stages when it's most curable. The 5-year survival rate and in a stage 1 is 90%, and the 5-year survival rate in a stage 4 is 17%. So that tells you how dramatic the drop-off is. And so, unfortunately, going through this, and as I can speak personally from my mom again, that downward decline. I think as a caregiver who is a health professional and thought she knew how to take care of herself, but there's a lot of stress that goes with it, and I think taking time for yourself first and foremost, and I think that's where a home care agency like American Advance can come in and help, because giving that respite care, giving that time for the caregiver to go out and do something they love. I was recently reading about the caregiver stresses, and so much of that is real. And I look back on myself and go, oh my goodness, the anger, the irritability, and it's healthy. It's a healthy break to be able to take that and do something for yourself. So if you have the opportunity to have a home care agency, someone you trust to come in and care for your loved one, that would be huge. And not to mention the medical side. Being a nurse, there's the medication, and there's the as you get into the advanced stages and the terminal stage, having the morphines and the medication, that gets confusing, and you don't want your loved one to be overdosing. There's a fine line between what's a comfort level and what's an overdose level, and so having skilled nurses who can come in and help would really be an advantage too, and recognize I think just overall comfort for everybody.
Yes, absolutely. Yes, indeed. So we're here to help. We're here to help patients as well as your alliance, right? Mm-hmm. What are some of those then challenges? One of those challenges that the alliance has, and how could supporters, donors, individuals, even agencies such as ours, how can we be of greater assistance?
Well, we are celebrating our 10-year anniversary, 2021. Through a pandemic, it's been challenging. We, because of the nature of our disease, we have a lot of women in chronic treatment, as I mentioned, so a lot are immunosuppressed, and so we decided not to have any of our fundraising events. So September would normally be chock filled with fundraising events for us, and we have none. So I should say none, but very, very few. And so we, at this point, would love volunteers when we are up and running again. I think every group, nonprofit, would need volunteers, but that's one way that can really support us. Another way is the advocating. As I mentioned, we always are looking for people who can help be that voice for their loved one, or for someone who might not be with us any longer, to continue, and it's not hard. I never thought I could go up to a politician and talk about hard things, and I've done it. So we train you well, and we have wonderful webinars that we can share, and then if you are a survivor, we're always looking for survivors who aren't shy, who are able to speak to others about their journey, and that's powerful. Survivors go back to my alma mater at Michigan School of Nursing, and they tell their stories, and they're educating the future healthcare professionals about the disease, and that will carry with them for a long time. As I mentioned, you get this amount in the medical school or nursing school and PA programs, and so if you can take that information and their stories, and it sticks with you. I remember when I heard someone telling me, and whether it's on your index as you're doing your assessment, and you're bloated, and you've had this for how long, and that can go a long ways. But we have programs. Tie Michigan Teal. You may notice teal ribbons tied throughout the state, and that's us. We have the symptoms of ovarian cancer on those teal ribbons, and we're always looking for new communities to help us bring those teal ribbons to their towns to raise awareness. Oftentimes I'll see people, what are those blue ribbons? They're teal, and they're for ovarian cancer. And unfortunately, our disease being teal, we don't have a dedicated ribbon. We share it with a lot of other things, and so it's important for us to say these are our symptoms, and it's right there. Our Teal Attack program, when I was saying that some of our events aren't happening, Teal Attack is going strong. It's a program that was developed by a woman who played volleyball locally, and she was doing a lot of Dig Pink events, and she realized, I'm an ovarian cancer survivor, and why aren't we doing this to raise awareness for ovarian cancer? And so in high schools and colleges throughout the state, not only for volleyball, but for other sports, they do Teal Attack. And Teal Attack is bringing awareness to those younger generations then about the symptoms of ovarian cancer. So we have one of those events coming up at Airport High School against St. Mary's Catholic Central this next Wednesday. So we're always looking for new schools, colleges, high schools, different sports to, raise awareness. And I think overall, I would be remiss to say Next Generation Ovarian Cancer Alliance was started at the University of Michigan by my oldest daughter when she was a student there, and her younger sister has carried it on, and we're hoping to see that succeed. But that too is on a college campus in hopes of raising awareness, and they tied the teal ribbons all around the University of Michigan. But we would love to see that at University of Detroit or Wayne State or anywhere else where there's clubs that would want to make a difference in raising awareness. And I think, bottom line, all of this information can be found at our website, which is MIOCA.org. And so all of this is listed. So anybody looking for something to do, there's a lot of information there.
Pam, absolutely phenomenal. Glad to hear about your daughter carrying the mantra forward with a new generation chapter of MIOCA. And that's what legacy is, right? Legacy is our ability to positively impact, influence, and inspire, right? Absolutely. And you are certainly doing that. Your grandmother did it, your mom did it, and now your daughters are. This has been a very wonderful and impactful, insightful episode of the Home Health Care Today show. Pam, we're going to have to invite you back on with your new executive director.
We would love that.
Yep, in coming months and coming weeks, and see how things are going for the Alliance. And we'll also represent with our teal colors as well, and we'll disseminate information about the symptoms
Thank you.
of ovarian cancer. Pam, thank you for joining us today.
Thank you for having me.